Thanks for joining us today. Welcome to the Center for State's video series on the essential functions for implementation planning and capacity building. This series is produced by the Capacity Building Center for States and funded by the Children's Bureau. Before starting this series, have you read the Implementation Planning and Capacity Building brief and completed the first section of the workbook? If not, we recommend you take some time to complete these steps and then return here to where you left off. Before we begin, we'd like you to take a few minutes to consider your own experience with planning for implementation efforts and building capacity. Have you ever needed to implement a large project and knew that it would require some preparation? What steps did you take? Have you ever needed to take on a project but knew you did not have everything you needed to do it? How did you know? And what did you do? Can you think of a time when you were a member of a team that was tasked with introducing a new program? What information did you need to know to begin? What information did you need to share with others to be effective? Use your implementation planning and capacity building workbook to write down your answers to these questions. Remember, you can pause this video at any time to record your thoughts and refer to them as you complete all 11 videos in the series. Before digging in, let's check in on a few key milestones teams should have in place before they begin looking at implementation planning. They should have a team with diverse expertise and representation to guide the change in implementation process. The team should have a clearly identified problem and an analysis of the root cause or causes of the problem. They should have a theory of change that reflects a clear pathway from the problem to a desired long-term outcome. They should have identified, adapted, or designed an appropriate intervention that is well-defined, a good fit, and is feasible within the agency's system. And they should have readiness assessment findings that include the areas of strength and capacity needs for the selected intervention or interventions. Taking the time to ensure that these key milestones are in place before moving into implementation planning and capacity building will increase the likelihood of successful implementation of the change initiative. Let's take a moment to define what implementation is in child welfare. Implementation is a specified set of activities designed to put into practice a program or intervention. An intervention could be any specific practice, service, policy, strategy, or program, or a practice model, or a combination that is clearly defined, operationalized, and distinguishable. What is an implementation plan? An implementation plan is a document that describes key steps and activities needed before and during implementation of a selected intervention. It should explain how an agency will prepare to implement an intervention and build needed capacity, as well as identify roles, responsibilities, timeframes, and milestones, and establish coordination and sequencing of implementation activities. Developing an implementation plan helps an agency by providing a roadmap for the implementation team, serves as a communication tool among team members, leadership, and stakeholders, helps identify needs and anticipate challenges to implementation, and supports decision-making and monitoring by leadership throughout, as well as contributes to quality implementation. Organizational capacity is the potential of a child welfare system to be productive and effective, and capacity building describes the process of developing that potential. When looking at organizational capacity, agencies can ask, does the organization have everything needed in order to be effective? Does it have the needed supports and infrastructure, staff knowledge and skills, or the partnerships to effectively implement a change effort? An agency's organizational capacity influences its ability to implement programs and deliver services for children and families, and is essential for change efforts aimed at improving outcomes. Through capacity building, agencies can enhance their organizational performance and improve their ability and motivation to implement a particular intervention through one or a combination of strategies. These strategies can include tools, training, technical assistance, and quality assurance or quality improvement, and help ensure readiness for successful implementation. The Implementation Planning and Capacity Building Brief is intended to help child welfare agency leaders, managers, and stakeholders take a structured approach to planning the implementation of an activity, program, or intervention to address a problem or need. It does this by providing step-by-step guidance to prepare for implementation, address gaps in capacity, and capitalize on strengths, and develop a plan for implementation that outlines how the agency will get ready before taking action to implement and measure. Implementation planning and capacity building is broken down into 3 parts and 8 essential functions or tasks. Part 1 is preparation and includes outlining the implementation plan elements, identifying sources, and considering the agency context, and revisiting teaming and leadership structures. Part 2 is planning for capacity building and includes reviewing readiness assessment findings and developing strategies to build capacity and strengthen motivation. And Part 3 is development of the implementation plan, including building a work plan for activities to get the intervention and the agency ready for implementation, building a work plan for activities that the agency will take to roll out and measure the intervention, identifying communication and engagement activities, and consolidating and reviewing the plan as needed. In this module, we will kick off our conversation about implementation planning and capacity building by looking at each part in a little more detail and considering how they work together to support change efforts. Part 1 of the Implementation Planning and Capacity Building Brief is preparation. It includes the 2 essential functions that help anchor agencies. Outline implementation plan elements, identify sources and consider context, and revisit teaming and leadership structures. An implementation plan captures and builds on work that has already been done, including establishing an implementation team, selecting, designing, or adapting an intervention that addresses an identified problem and a theory of change, as well as assessing readiness. By laying out the team's thinking about what needs to happen next, the plan serves as a guide for preparing, testing, piloting, staging, monitoring, and evaluating the intervention. Before diving into the development of a comprehensive implementation plan, teams should prepare by scoping out the plan elements and sources, reviewing relevant documents and work to date, and revisiting team membership needs. Revisiting teaming and leadership structures lets a team ask, do we have the skills and expertise needed to implement this intervention? Are different team members needed to carry out implementation than were needed for problem exploration or identifying an intervention? Does the structure include clear leadership and teaming organization? Part 2 is planning for capacity building. Capacity building strengthens an agency's ability to implement a selected intervention. An agency's capacity building activities should inform its implementation plan. The essential functions in Part 2 address reviewing readiness assessment findings and developing corresponding capacity strategies. Planning to build capacity helps teams identify and prioritize gaps in their readiness that need to be addressed before implementing a selected intervention. Moving through the 3rd and 4th essential function, teams should review relevant readiness assessment findings to identify overall agency capacity needs, areas to improve motivation, intervention-specific capacity needs, and existing strengths that will support implementation. And then develop and prioritize strategies that will build capacity and strengthen motivation in the areas of need that are relevant to implementation efforts. Part 3, Implementation Plan Development, includes the last 4 essential functions. By asking a few key questions, teams can flesh out the information needed to complete the implementation plan. To prepare for implementation, ask, what tasks does the team need to complete before implementation begins? Who is responsible for each task? When will the task be complete? To prepare for rolling out and measuring the intervention, ask, where will the intervention be implemented? What testing, training, processes, and measurements are needed to successfully implement the intervention? To identify communication and engagement activities, ask, how will the intervention be communicated? What is needed to cultivate buy-in for implementation? And to consolidate and review the implementation plan, ask, what challenges or barriers might be risks to successful implementation? Are the key stakeholders on board? Let's take a moment to check in on what you've learned about the key phases and essential functions in implementation planning and capacity building. Why is implementation planning important? It serves as a roadmap and helps teams determine how they will prepare, including where they need to build capacity and motivation for quality implementation. Why is planning for capacity building important? To identify and prioritize gaps and strengths in readiness, and develop strategies to address them and improve motivation prior to implementation. What should teams consider when developing the implementation plan? The activities needed to prepare for implementation, the activities needed to test or pilot, implement, and measure, and activities to communicate and engage stakeholders. Up next is outline the elements of the implementation plan, the second function in implementation planning and capacity building for change in implementation.
This video was created by the Capacity Building Center for States, funded by the U.S. Department of Health and Human Services, Administration for Children and Families, Children's Bureau, under contract HHS P23320140033C. The content of this video does not necessarily reflect the official views of the Children's Bureau.